Hey, this is Kat with Diagnostic Solutions Lab. Thanks for joining me today on a tutorial and overview of the gluten peptide add-on marker to the GI map stool test. Patients and providers with a goal of maintaining a gluten-free diet are always looking for a tool to definitively identify gluten exposure. Primarily, we have relied on antibody testing, such as anti-gliadin IgA in stool or blood antibodies to gluten, as both a measure of immune response and an indication of exposure, as antibody testing is by and large exposure-based. But there are variabilities with relying strictly on antibody testing as a reasonable test of exposure, such as individual immune response and antibody half-life, in addition to immune system cross-reactivity. The gluten peptide test is a direct test of gluten exposure and minimizes ambiguity. The stool gluten peptide is a direct measurement of 33-mer gliadin in stool. 33-mer gliadin is the highly immunogenic peptide in gluten protein. This peptide is resistant to human digestion and can be detected in stool 2 to 4 days after gluten exposure. Diagnostic Solutions now offers this as an add-on to the GI map as a test to monitor gluten-free compliance in your highly sensitive or autoimmune patients. This test provides a quantitative result of gluten peptide detection. Any result over 5 nanograms per gram of stool is considered positive for gluten exposure within the previous 2 to 4 days. A result below 5 will be reported as less than DL or non-detected. Not surprisingly, we find detected gluten peptide in the samples of gluten-free compliant patients very frequently. The opportunities of gluten exposure are many in our society. The testing with this gluten peptide is actually included in AGA Best Practice Guidelines number 2 for refractory celiac. A question we get frequently is how the gluten peptide add-on test differs from the anti-gliadin IgA marker that is included and comes standard on the GI map. Well, as we have reviewed, the gluten peptide is a direct measurement of immunogenic gliadin peptide in stool. On the other hand, anti-gliadin IgA is a mucosal immunoglobulin or antibody response to gliadin protein. A detected level of gluten peptide is a direct measurement and is indicative of intake within the last 2 to 4 days. An IgA result should be negative if the patient is on a gluten-free diet, but this result has some variability and can be influenced by the concentration of total secretory IgA. In this way, the gluten peptide is a test to monitor gluten-free compliance and to detect accidental and unintentional exposure. Thank you for joining me on this brief tutorial covering the gluten peptide add-on marker for GI map.